So the amyloid hypothesis has existed broadly since, probably the mid to late 1980s. And in the past, people have sort of viewed the amyloid hypothesis as something that's monolithic. You're just talking about amyloid plaques, or you're talking about A-beta monomers, but they would lump all these different drugs that have been tried that address the amyloid hypothesis broadly. They would lump all those together. But what the field has learned over the last 20 years is that the amyloid hypothesis is not monolithic. And in fact, the differences can make a real difference, we believe. What's now clear is that the A-beta monomers that make up the plaques, the A-beta monomers themselves are not really toxic. You can drop those on top of a nerve cell and the neuron's perfectly happy. On the other end of the spectrum, for the actual plaques, the deposited plaques that are insoluble, those actually aren't toxic to the neurons either. Again, you can take a fibril that makes up plaques, put it on a neuron, and the neuron's really perfectly happy. Now, there is some inflammation around plaques, and that could be part of the story, but the plaque itself is not really toxic. But what we've found over the last 20 years or so is that there are soluble species that are not monomers that are toxic. And so the oligomers that we target are a globular shape, they're soluble, and if you put those on neurons, that causes problems. So it disrupts something called long-term potentiation, which is a normal electrophysiologic function of neurons. You get a big influx of calcium into the cell, which is not a good thing. And it can also lead to hyperphosphorylation of another protein called tau. And that's actually, besides the plaques, there's also tangles in Alzheimer's disease. The tangles are made up of this hyperphosphorylated tau. And so what we know from these experiments is that when you take these globular oligomers and put them on a nerve cell, that triggers the downstream pathology, we believe. And that's why we really think these soluble oligomers are really the best target in Alzheimer's disease. And ACU-193 is actually the first antibody that was specifically designed to target those oligomers. So the oligomer hypothesis, as you correctly call it, really hasn't been tested yet. The one other thing I should mention, just in the sake of completeness, is that there is an antibody called lecanemab that was designed to bind to something called protofibrils. Now, protofibrils have a different shape than the oligomers that we target, but they're similar in that they are soluble and they're toxic to neurons. So lecanemab actually just recently got FDA approval. Now, lecanemab also has some plaque lowering, and we can talk about that. But there are some similarities there. But we think ACU-193 program is the one that really purely tests this oligomer hypothesis.